Hi, everybody, and welcome to Cat Chat Live. Apologize for starting a few minutes late. Had a few technical difficulties. You know how those things can happen. But my name is Nancy Stevens, and I'm so glad that you're here with us today for today's topic, which is Wildcat Wellness. In just a few minutes, you're going to get to meet representatives who oversee different aspects of our student health and well-being programs and resources, and I'm excited for you to learn more from them. But to get things started, I do have a few housekeeping items that I always like to review, particularly if this is your first Cat Chat Live webinar with us. We will take your questions during today's webinar, but we would ask that you hold them until our designated Q&A time after all the slides have been presented. We anticipate that we will address many of your needs through those slides, but we'll happily take those questions at the end. You'll use the Zoom Q&A feature to communicate with us. My colleague Kate will be putting links in the chat for your future reference, but you'll use that Q&A feature to communicate with us. We try to keep these Cat Chat Lives at no more than an hour, so we'll take as many questions as we can during the allotted time, and we'll make sure we leave you with contact information for any questions that you have after the fact. If you're not able to stay with us for the entirety of today's Cat Chat Live webinar, it is being recorded, and the recording will be posted to the Cat Chat family community later this afternoon, so you can look for it there and any other recordings that you may have missed from earlier in our series. If you have questions about any other topics related to UK, kind of beyond the scope of today's health and well-being discussion, I encourage you to email parents@uky.edu at any point for assistance. At the end of today's webinar, you'll see a link for a quick survey. We always love to get your feedback about how today's Cat Chat Live met your needs and what questions you have that we can address with future Cat Chat Lives. We do have more to come in our Cat Chat Live summer series. On Monday, we'll be chatting with the Office of Residence Life about what life looks like in our residence halls. So much of the focus right now is on move-in, but our students will be in the halls for the entirety of the school year, and we want them to feel comfortable and ready for that experience. A week from today, we'll be discussing campus safety with UK's Chief of Police, Joe Monroe. I hope you can join us for that. And then you can see on the screen other topics that we have coming up involving getting involved on campus, finances, which we know are on so many folks' minds, helping your student navigate peer relationships and conflicts they may experience while they're here. And then we'll be talking about some academic resources as we look ahead to the first day of class. Registration links for all of these are available in the Cat Chat family community if you plan to join us live. If you're not able to join us live, no need to register. You'll just look for those recordings after the fact in the Cat Chat family community. As always, Cat Chat is going to be your go-to source of information for all things UK parents and families, and I hope you're taking full advantage of all of the resources and the information contained there and letting other members of your student support system know about it as well. One of the things you'll see in there right now is the opportunity to register for Family Weekend coming up at the end of September. We hope to see many of you back on campus for that, and all the details that you need are on the Family Weekend website and in the Cat Chat family community. So those are my housekeeping items. With that, I want to turn things over to Dr. Dan Bureau. He is our Assistant Vice President for Student Wellbeing, and he has some really good information for you about all of the ways that UK supports student well-being, and then he'll be handing things over to University Health Service to talk about all of the good work that they do in support of student health. Thank you so much for being with us here today. Dan, I'll hand things over to you.
Thanks, Nancy. I always love talking to parents and families about the opportunities that lie ahead for their students. I spent some time working in that area at a previous institution and just think that the work that Parent and Family Services does here at UK is just above and beyond. So just grateful that you all invited me to come today and talk about my favorite thing to talk about, and that is student well-being. One of the things I'll say is that I believe that as important as getting a degree in college is that students develop a sense of self, a sense of purpose, a sense of meaning, a sense of overall well-being that they can take from UK and translate that into being just a terrific global citizen, right? So when I talk about well-being, I don't just talk about services we provide. I talk about kind of a belief system that students can develop and engage in throughout their time here at UK. Ultimately, I believe that your students will persist and be successful here because one of their goals should be to develop those approaches to well-being. So as we transition to the next slide, I think it's really important that we kind of couch well-being around the larger functions that we have within student success here at UK. There are four verticals here at UK, and I think if you went to BBNO this summer, I know you probably saw this as part of the opening session from either Dr. Sarah Ballard or Dr. Kirsten Turner. But we talk about these four areas as ways that students can succeed, or possibly there are barriers that get in the way when they're not properly managed, right? And wellness is one of them. I believe that as students navigate issues around academic success, their financial stability, how they feel connected, that they belong, those also are going to impact their sense of well-being overall. So I talk about well-being very holistically throughout this because there have been periods throughout your student's life where they have had to focus on this, they've had to manage their different ways, but when they come to college, it really does become this, I'm doing this on my own. And it's important to note too, as you say that like parents and families and support systems, they're not left behind, but they're part of a larger structure that we want students to use as they kind of begin to make decisions around their own well-being decisions, right? So previously it was, the parents made the appointments for the pediatrician or the primary care physician, or the counseling sessions, meeting with the psychologists, or working on the 504s in order to secure accommodations, the sports the students did, right? Like there are lots of ways that people have made decisions previously. Coming to college is going to be a lot of making decisions on their own around how they manage that well-being. Parents are still super important in that process, and I want you to hear loud and clear that we want to engage you all very, very much in that process. And as the next slide shows, that as we're trying to help students move to that place of managing for themselves, we want to create this sense of like interdependence with both the families, the support systems, the services that students have left behind them as they come here, but also with the resources, the services, the staff, the support systems, their friends, their residence halls, whatever is surrounding your student when they get here. We want to create that sense of interconnectedness, interdependence in order to help them achieve their goals. A goal is to move towards independence, but we want you as parents and families to hear loud and clear that we want to work with you and with your student in order to develop approaches that will make sense for them here at UK and thereafter. Because when they get here, they're going to manage a lot of natural adult transitions. And so the next slide talks about just some of the issues that students do face very early on. And like every student experiences these. It is not just students that have a history of mental health or have had to manage a disability in the past. All of our students experience one or more of these at any point in time, especially during those first few weeks, because the transition to college is so significant. And for many students, they've never experienced something this significant in terms of a single transition point in their lives. I want you to know, though, that we at UK are deeply committed to having the resources, the services, the people that can help students succeed from day one. But some of the things that students will manage will look like, very common things that people that are in that age group of 18 to 24, they experience this, right? Different levels of stress. There may be a clinical diagnosis for anxiety or depression, right? But also, those are just natural feelings that people might experience as they transition into new things and a lot of things that are uncertain for them, right? They're excited to be here. We're going to surround them with all the resources and services that they need. But also, it's a tough transition for a lot of students. They may be lonely, right? They may have left their friends behind and they're making new friends, but that transition does present sometimes as loneliness. Students come to college and have learning differences that might be in the demonstration of a disability. You might seek accommodations for that, but also just like college is different in terms of the academic demands. And so that transition is going to have an impact on your student. Your students also going to change how they approach their well-being, their daily routines, their habits. And those habits, what might have looked like, well, I exercise at a certain time of day, I go to practice at a certain time of day, I have dinner made for me at home, or I eat lunch at this time, that's going to look different. Going to bed, getting the kind of sleep they need might look different too. They might not balance their time well. And so these are all things that are going to be presented for your students. And as they use our resources and services, I believe they can develop the skills and strategies they need in order to manage these all really well. This list should not be terribly surprising for anyone. It's a natural part of life to manage all of these things. But I will say that 18 to 24-year-old kind of time frame is really the part of adult development where the most significant change is happening, not just in terms of like the transition to college, but in their brain development, their body development, etc. So let's go to the next slide and talk more about what it looks like because a lot of students do experience some level of dissonance or confusion, and previous ways of knowing, previous ways of doing things might not translate necessarily well to the college environment. The good news is that you can scale those pretty quickly, and students do learn very fast, but whether it be study skills or managing money or just managing relationships, previous ways of doing things might look different or need to look different when you get to college. And I think that as students don't have necessarily the skills to manage that, sometimes that can present itself as a crisis. Now, that crisis could be something, very small in terms of what we're thinking about, or it could be a real significant issue that we need to help them tackle. And we have the resources and services here at UK in order to help them manage those, whether it's small or large. I'm not trying to dismiss the crisis by saying it's significant or not, because it's all significant to your student, right? Because this is new for them. But that being said, sometimes the crisis might be best met by getting some academic support or joining an organization. But sometimes your students do need services in our mental health or physical wellness, those kinds of spaces that will benefit them, that might help them overcome that crisis. Um, and I do want you to know too that a lot of times these crises are very temporary, but it is important that your student uses our services in order to kind of manage these as they make that transition. So going to the next slide. So, what are the areas that we want to focus on when it comes to wellness? And as I said before, I believe that everything students do tie back to their wellness. So some of the things on this screen might feel like things, oh, connection, involvement, belonging, spiritual, intellectual. Those are all things that your students might receive services from other areas. But there are three of these areas that I really want to zone in on today to talk more about the services that we provide here at UK under my area of well-being. So that's emotional wellness, intellectual wellness, and physical wellness. And I'll talk briefly about some of the services that I oversee. But I will say that this is not exhaustive. And our good colleagues at University Health Service will explain some more things about what they do. But there are lots of resources around campus that can help your student manage their well-being. So going to the next slide, I'm going to spend a few minutes talking about the 6 areas I supervise. Your student may have an existing approach to movement, to exercise, to their kind of management of their physical wellness. When they come to UK, they pay a campus recreation fee. It's one of the lowest in the SEC and the Big Ten. So any of our comparable institutions, UK is a great bargain in this area. But your student has access to our rec centers, both at the Alumni Gym as well as Johnson Center. And that means things such as weights, cardios, group fitness, intramurals, aquatics, outdoor adventure. Create your own strategies. Use our indoor track, play basketball, whatever it is. And we have very reasonable hours, often from 6 a.m. to midnight, in order to allow your students to fit that in when they can. And again, at the end, we'll answer some questions around this, but that is a service that all students can engage in pretty much when they need to fit it into their demanding schedule. Our Disability Resource Center, we have over 4,700 students that have one or more documented disabilities for which they receive accommodations. If you have a 504 in high school, it does not transfer to college. What is required in order to secure accommodations is a diagnosis. It could be medical, it could be mental health related, but it has to be a diagnosis documented by a primary care physician or a clinician, a counselor, a psychologist. And then we review that and determine which accommodations might be best for your student. End of the day, those accommodations may look very similar to what you might have had in a 504, but the settings, the demands, the expectations, the proof of verification is all very different when you get to the college level, and we're not unique to that here at UK. So what I'll say is that if you want to submit that, and I certainly encourage folks to do this before they even get here, use our Disability Resource Center portal to upload your documentation for review, and then you can start the semester off with those accommodations if your student needs them. More information on that is also found on the website. Power is our health and wellness education office. They provide both ongoing education to individuals, but also large scale primary prevention to populations of students. Our students in residence halls and fraternities and sororities and other clubs and organizations would receive um, optional education in those environments as well around areas such as alcohol and other drugs or stress management. They provide that education at request of any student organization, and then students can use their services in order to kind of develop their own plan for well-being. The last 3 years, I'll talk about kind of time more into that mental health space. And if your student has an existing relationship with a provider, with a psychologist or a clinician back home, um, it could be important that you set up a local point of care and contact in terms of doing that. We have community services, but if your student wishes to engage in a short-term therapy model that would allow them up to 10 therapy sessions a year, they can use our tracks and our counseling center. Let me explain more about how that works. TRACS, the first letter in there is a T. It stands for triage. And what TRACS does is it meets with the student and determines what it is that is their primary challenges they have to address. And then as a result of that meeting, they might receive a referral to a campus resource. And for some students, that will be counseling, where basically you might go and engage in that up to 10 different sessions for therapy. But for some students, after that consultation, what they realize is that, well, my what I'm expressing as anxiety is really not being able to manage my academic demands. Or what I'm expressing as depression is just the fact that I've not yet made that connection that I need. And so therapy may be an option, but also it might be a referral to a different service. So TRACS allows our students to get the referrals to the services that will best meet their needs in terms of what is challenging them. If they engage with counseling, that's up to 10 sessions over the course of the year, and that resets every year. It's a short-term therapy model. If your student has more acute or needs more ongoing, more frequent therapy, it might be important for them to either find a way to maintain that relationship with their provider back home or establish one locally here with someone outside of the university. The other service we provide is our VIP Center, which is our violence intervention and prevention, which provides education and support for individuals who have experienced some interpersonal violence, and that is a confidential survivor advocacy function that office provides. The last slide that I will talk about is just a reminder for a few key actions that we need your student to engage in before and as they transition to college. The only requirement we have for immunization is a meningitis verification. A meningitis is very serious, especially if the student's living in the residence hall. And the requirement is that if your student does live in a residence hall, they should submit documentation that they have met the requirements for that meningitis vaccination. The top two QR codes up there, you can scan those and you can see the information on what constitutes the right variant for the meningitis, and then also how you can submit that documentation in order to meet the requirement. The last thing I'll say before I turn it over to my good friends over there at the University Health Service is that there are 3 educational modules that all first-year students have to complete. This allows us to meet federal as well as campus safety expectations, and that's education around alcohol, prevention of sexual assault, and hazing prevention. Those are all things that must be completed or can result in a hold on the student registration by the end of September. So getting that done before you even come here is a really great idea. And probably between the 3 of those, it takes about 4 hours collectively. You can stop and start as you want, but that is a requirement that all new students have to complete. So, Nancy, I think we're going to turn and do questions later on. So I guess I'll turn it over to Andy and Shelley to talk about our great services over at UHS.
So my name is Shelley Chenault, and I am one of the nurse practitioners over at the University Health Services. And I'm going to talk a little bit about the things that we offer through our service for all of our students here. If we can go to the next slide. So the location of our building, we are kind of sandwiched between the hospital and the UK clinic. It is on Limestone, South Limestone Street. If you can find the speed Speedway gas station, that's kind of our landmark, then you can find our building. We are directly across the street from the Speedway gas station. The primary care and GYN services are on the second floor, and we are there Monday through Friday. We're there from 8 until 5 p.m. We also have behavioral health services that are available. They are in the same building. It's on the fourth floor, and they are available Monday through Friday from 8 to 4:30 p.m. And we can go to the next slide. I also wanted to mention that we do have a bus route, our blue and white bus route that does go, like, particularly from the dorms, and it goes kind of around campus, that does have a stop right in front of University Health Services. And then the white route goes in the opposite direction, taking them back to where they came from. So if they're unable to make it by walking, they don't have a car, just feeling really bad, they can hop on the bus and get there right to our doorstep. We want all of our students to please sign up with MyChart so that we can be able to have a medical record for them, as well as be able to communicate with them for various things. If they have any labs that are done, we are able to communicate with them through MyChart. Any kind of questions, concerns they have, anytime that they're going to come into student health and they might need a school excuse or something like that from having missed a class, we send those all through MyChart. So really important to have that MyChart set up when they come in. They also need to manage their own account, so it should be an email address that they have access to, and they are going to need to set up their own password. If they don't have access to that, then we have no way to communicate with them in that method. Next slide. So what they need to bring to their appointment. We need to have their student ID. If they have private insurance, we would like to have a copy of their insurance card if they're wanting us to use their insurance for any of the services that are provided. We need a list of their current medications, and it's helpful if we have the medication name, the dosage of it, how often that they're taking it. All of those details are very helpful, especially if we are potentially having to refill medications. Also important is their allergies. So not even just their medication allergies, but even some, chemicals and things like that can have cross sensitivity. So we need to know a list of all of their potential allergies. They also need to have some form of payment. So if there are things that are going to potentially have costs that are outside of what the university health fee covers, they're going to need to have a method of being able to get that. So sometimes, like prescriptions, things like that, they might have like a copay or something that they'll want to use their insurance and then need to have some way to pay for that as well. University Health Services does bill most insurance plans. We do encourage our parents to find out what kind of coverage their student has while at our school. Sometimes they do have provisions that allow your student, if they are out of state, to be able to get care in network within our facility, so you can check on those provisions. I do know the biggest one that we are unable to use is if the student has out-of-state Medicaid. We are unable to bill any Medicaid that is not within the state of Kentucky. Next, please. So there's also different ways that we cover the care for your student while they're with us. So they can have their private insurance, but every student that is full-time, undergraduate, there is a health fee that is billed in to their tuition. And this health fee covers any number of things. They have any number of visits, office visits that they can come to see one of our providers. We have certain tests that we also provide that are at no expense to our students. There's even some medications, antibiotics, things like that, that we can prescribe that they're able to get at our student pharmacy that would be of no cost to them. So it's actually a really, really great benefit to have, considering it's like around $130 something a semester. And they could come and see somebody almost every day, Monday through Friday, if they needed to be seen. So I think it's a great benefit for our students. The other option that we have is the student health insurance plan. So this is a Anthem Blue Cross Blue Shield plan that can actually be purchased. So if you had a really high deductible insurance plan, if your insurance plan was not going to cover your student, being out of state, things like that, sometimes this could be a great option. It still has like co-pays, deductibles, all of those kind of things like private insurance does. But there are ways to purchase that insurance, and you can do it for like the fall semester only. You can do it for the spring and the summer semester combination only, or you can do it for the whole year. So you can break it up if you need to do that as well. Next slide, please. So these are some of the things that the health fee covers versus things that are not covered. So the things that are covered, like I said, the office visits, we do a lot of testing for like strep throat, urinary tract infections, pregnancy testing, mono testing, things that are not covered. So we do not cover COVID and flu testing. However, I do like to make sure that all of parents and students know that our student health pharmacy has a self-test kit for flu and COVID that runs like around $10. And I think you can get them at like Kroger and stuff for like $25. So having, one of those like little home test kits and get it right there at the student pharmacy and, have it at home. That way, if, they needed to take a test to see if, they were sick, at least that way we don't have to worry about, cost coverage and things like that. And we're able to direct them as to the things that they can do to take care of themselves during that time. Other things like blood work, MRIs, X-rays, some of the ADHD testing and things through behavioral health, those are things not covered. And dentistry is not covered with our health fee. Next. Primary care, so in student health on the second floor, we have primary care and gynecological services. Primary care will do sick visits. We also offer telehealth visits. So especially if, it's like I got a really bad cold, I don't really need to come in there and spread my germs to everybody, but I cannot go to class. Sometimes we can just do a telehealth visit. We're able to see, you look like you're not feeling too good, give you some advice on how to take care of yourself and be able to get you a note. So that can be really convenient. We do like just some physical exams, screenings, things like that. We do not do Department of Transportation physical. We are able to manage chronic diseases. We do a lot of STI testing, treatment is indicated. We can do lifestyle management, and we've got a sports medicine doc. So sprain an ankle, things like that, come and see us. Next. We do have a suggested dorm care kind of kit that we just put together. And it's just kind of a recommendation, things that, we see that students may commonly need that are things that they could manage from home. So in the kit, they could have something like a thermometer. That way, if they're sick, a lot of things we want to know. Are you having a fever? That kind of directs, some of that guidance as far as, how cautious they need to be being around other students as well. Some over-the-counter medications, like having some Tylenol or some ibuprofen, some Benadryl if they get bad allergies. And I will tell you, if you're not from Kentucky or around this area, allergies are very, very bad, spring and fall. And then things like Pepsid, even like an ACE wrap, things that, could potentially, just need Band-Aids, simple stuff that mom typically has in the cupboard that they don't even have to think about. Next. The gynecological health services that we offer, we do screenings as well as problem visits. So we do pap smears that start at, age 21, problem visits. We do simple things like UTIs all the way to complex things like chronic pelvic pain, PCOS, endometriosis. We do, again, a lot of STI testing. We also do birth control prescriptions, management, and pregnancy testing, counseling, and referrals. We do not do prenatal care through University Health Services, but we can confirm pregnancies and give any counseling and referral to the correct places. Next. And so this is our behavioral health slide. I don't know if Andy was able to jump on or not. I know she was having some problems logging on.
I'm happy to talk about the behavioral health if you'd like.
Perfect. All right, I'll let you go. I'll turn it over to you.
Thanks. You've done a lot of the heavy lifting, which I'm grateful for. So we also have behavioral health services. So we offer several things. Primary focus is medication management. Previously, they talked a little bit about the counseling center and counseling availability on campus. We partner with the counseling center quite a bit as far as like talk therapy, kind of like acute therapy needs, but our behavioral health focuses on medication management. So if you have a confirmed diagnosis already or a medication that you just need to continue, or if you want to pursue perhaps like some symptoms that you're having and maybe a new diagnosis, you can do either one with our behavioral health. They offer crisis intervention, medication management, and then referrals to those campus resources and community resources that we talked about earlier. The visits are covered by the student health fee. Medication, testing, and labs are not typically covered by the student health fee. But again, we try to cover what we can without having to bill your insurance. ADHD, we get a ton of questions about. So I might belabor this a little bit. If this doesn't apply to you, just ignore me. So there's typically two types of patients. There's those that are already diagnosed with ADHD and those that are pursuing diagnosis, kind of what I was talking about a moment ago. With the already diagnosed, typically we recommend you just bring in some documentation. If we need to take over some prescribing while you're on campus, a lot of ADHD medications are controlled substances and they won't transfer well over state lines. So sometimes we have to kind of take over those prescriptions. If you come to your appointment and just bring some documentation of that diagnosis, maybe your pill bottle with your medication, so we know the dose, the frequency, all the things, then we can kind of pick up and take over. If you're pursuing diagnosis for ADHD, then that takes a couple of appointments. We're happy to help, but the first appointment, you kind of talk about symptoms that you're having, make sure that ADHD is, a diagnosis that would make sense with the symptoms that you're having, and then we can pursue some testing and come back to talk about treatment after. We offer medication management, including non-stimulant options, so not controlled substances for ADHD. We do urine drug screens, though, for treatment for ADHD. We also get a lot of questions about nurse appointments because we have a ton of students that get allergy injections. So the biggest thing with that is new patients need to schedule an initial nursing appointment. When Shelley was talking about the hours in the clinic earlier, those same hours apply to our nursing schedule as well. So just schedule an initial appointment and they can help you sort your vials, all the things. Our nurses also do a lot of compliance for students in health science colleges and international students. So a lot of health science majors will have some requirements as far as like a TB screening or vaccinations and things like that. And honestly, our nurses are amazing. They probably know more about the compliance for the health science than I do. So they do a great job. And they also do phone triage. So if your student isn't sure what to do, like, do I need an appointment? Do I just need a note? Is it okay to take Tylenol for a fever? We have some phone triage from the nursing staff. So your student can call, and if they're not sure what to do, the nurses can kind of give them some guidance. And if they need to schedule an appointment, help them get scheduled, just kind of facilitate whatever they need. Um, we already talked about the meningitis requirement for UK housing, so I won't belabor that anymore. Pharmacy information. So we can transfer refills. Um, you can contact your home pharmacy and do a transfer to one of the on-campus pharmacies. So if your student is on a medicine that they take every month and they're good with it, they don't need any changes, they have plenty of refills, they just need them moved, then you contact your home pharmacy and tell them, hey, my student's going to college. Um, I need to transfer to something on campus, and there's two options. There's the Kentucky Clinic Pharmacy, which is right next door to us, and then there is the Apothecary Pharmacy, which is in the Student Center. So, kind of depending on where your student lives, they can choose whichever one's closer to them. Again, those controlled substances won't transfer over state lines. So, if that's something that we need to pick up and take over, they'll need an appointment in clinic. And then time for questions. There's a couple links. There's one to the student well-being website and their email, and then there's the UHS.
Y'all covered so much good information there. Well, families have learned so much, and now it's time for their questions. So, encourage you to use that Zoom Q&A feature. One of the questions that I know that I get a lot from parents and families or see them ask sometimes in those unofficial Facebook groups is asking about kind of after hours care and urgent care and how students can get support if, because obviously, getting sick doesn't always happen during regular business hours. So I don't know, Andy or Shelley, if one of you wants to speak to kind of that urgent care after hours care piece.
I'm happy to do that. So, as far as urgent care, there's a few different urgent care options affiliated with UK. Um, that would be like Turfland, Fountain Court. So, we've got some options. Turfland would probably be the closest. Of course, there's two ERs on campus or in the campus vicinity. Um, we also have for emergencies, we have an on-call provider phone line that students can use. We do recommend you just use that for emergencies. However, I do feel like we have pretty good availability. So if your student is sick with something like an upper respiratory or stomach trouble or something like that, and they don't start feeling crummy till late in the afternoon, if they call or get on my chart and schedule, usually they could get in the next day or at least within the next couple days. So we do typically have pretty good availability in that way as well.
That's helpful information. All right, our questions are starting to come in. We've got a couple related to vaccination immunization. One is the documentation needed if they're not living in a dorm? And then Brandy's asking for us to reiterate where immunization records get sent. So I don't know if which one of you wants to take that.
Sure, I can take that. You do not need the vaccination documentation submitted if you do not live in a dorm in the residence hall. And then it is submitted through selfreport.uky.edu. I know that Kate can put that in the chat. And you answer a few questions, upload the documentation. It is reviewed by one of our University Health Service nursing staff. And then if you don't hear from us, we're all good. Otherwise, I'll get back to you if there's a need for any sort of revision of the documentation.
All right, that's good to know. Judy's asking how much the campus recreation fee is and how that is paid.
It's paid as part of your normal tuition and fees. It's $104 a semester, and it allows full access to the recreation centers when we are open. But it's just part of the fees that you pay. You don't have to pay anything extra.
Yeah, and I know over the summer at Big Blue Nation orientation, so many of our first year experience ambassadors were singing the praises of group fitness classes and all of the things that they can take advantage of through campus recreation. All right, Dan, this next one's for you as well. Sherry's asking where students locate the alcohol and hazing education modules that need to be completed. Have those opened yet for this semester? I
Yeah.
know no
Yeah, thanks,
students will
Sherry, for
get
asking that
communication.
question. It actually is next week on the 28th that email goes out. So thank you for asking that for a point of clarification. But all students receive that invitation on the 28th.
And I'll make sure that it gets in the Cat Chat family community so families are aware that it has opened for this coming fall semester. All right, these next two questions are about insurance. Dell's asking how we find out if our insurance is accepted, and Brandy's asking about can they go ahead and upload insurance cards?
So if you set up a My Chart, you absolutely can go ahead and upload your insurance card on there. That question's just a little bit easier to answer. As far as coverage goes, there's no insurance specifically that UK won't accept. We formerly were not accepting Cigna for a brief period of time, but if you've seen that around anywhere, that is no longer the case. So as far as insurances we accept, we're all good on that front. However, as far as what your coverage is, it kind of depends insurance to insurance. Typically, with your insurance, there will be like an app or a website that you can go to and kind of input some information, and it will let you know what your coverages are. And we can also run estimates on some things for students when they're in here. As far as like, does your insurance cover COVID, flu, things like that? We can run some estimates, but I do always like to remind people that they are estimates. So, um, yes.
All right, we don't have any open questions right now, but we may have some folks who are still typing and inputting those questions. Earlier, you mentioned, or Shelley mentioned, one doctor's notes. I think one of the learning curves that I see in students is kind of managing for themselves how sick is too sick to go to class. And so I'm wondering how you advise students on that, some things that families can keep in mind, and kind of how that works about getting doctor's notes to missing class versus students just making their own determination that it's in their best interest to stay home.
So one of the big things that we use is, do you have a fever? If you have a fever, then you need to come in. Especially in that cold and flu season where you might just be having some mild symptoms, like maybe a little runny nose, not quite coughing, things like that. Um, but I mean, there is like a certain learning curve for sure with how do you feel? Like if you feel like you cannot sit through class, you will cough the whole time, you have to vomit, you have to get up and pee 100 times or something like that, then you need to come in and see us because those are disruptive symptoms. If you feel like you're having symptoms that aren't disruptive to your life, just annoying, then that might be something that you kind of schedule around your class schedule. But it is very much a case by case thing. And I do feel like students have to get in the swing of realizing like, is this disruptive or is this a little annoying? And there is some learning curve to that. But one hard fast rule I would say is if you've got a fever, especially in that cold and flu season, you need to stay home.
Yeah, that's good advice. And I think, and you all would know this better than me, I think in this kind of post-COVID world, I think there's more and more questioning about like, should I try to push through or should I just stay home and stay in bed? So that's some of the things that students have to learn to manage more independently. While we're on the topic of learning curves, I'm interested if there are any other things that any of you really see that students kind of struggle with in the initial transition as they, as Dan put so well earlier, kind of moving from dependence into more independence. What are those learning curves that families maybe can help prep their students for in advance?
Um, I'll just say that every student will tell you that they're depressed or anxious or things aren't going. I mean, lots of students very normally have these kinds of experiences early on. Some of it will require them to seek some services, but it's not always like a major crisis. And, I really liked what Andy said earlier about like just trying to like navigate these things and figure out what works for you. We are more than happy to respond to any of those needs, and there are a lot of people that can do that. But I do want to assure you that a lot of this is just natural adult development that your student will experience. It's a challenge for sure, and we're here to help them succeed at it. But they will have some challenges.
I feel like healthcare wise, especially with some common primary care complaints, something that I typically see, especially in the first couple weeks of class. One, it's like Nancy was saying, that students have a hard time kind of discerning what is worth missing class for, which is something that we can kind of discuss. But a lot of students are very uncomfortable with common over the counter medications. So, like treating a fever with a Tylenol or an ibuprofen, or um, if they have like they're itchy or they're having a reaction, maybe some allergies, they can do a Claritin or a Benadryl. So that way they aren't miserable until they come in to come see us. So maybe some literacy with those types of things would always be good, just because I do feel like a lot of times students like go to their parents for those things, and then you guys know what to do, of course, but maybe verbalizing a little bit more kind of what you're doing and why could be very beneficial. And I feel like that's just one of those things you don't even think about. But they soak everything up like a sponge, so I would love it if they soaked that up too.
Yeah, Andy, that's such a good point. And I'll shout out the folks at the apothecary pharmacy in the Gatton Student Center. And I'm sure this happens in your facility as well. I'm just in the apothecary more often because of its proximity to my office. But I know, last winter when I was trying to determine, did I have a cold? What was going on? I was just popped into the apothecary and was looking at the over-the-counter medicine that was there, and somebody came over and said, what are your symptoms? What's going on? Like, how can we help? So I really appreciated, having that resource there so close on campus to be able to talk through and to get the always great prices there at the apothecary. So shout out to them. All right, we've got a couple more questions that have come in. So Brady's asking about forms that the parents need to have the students sign so they know what's going on medically.
I can answer that. So there's a couple different things in the My Chart, which again we do recommend that they be the primary user of their My Chart. They can set a proxy as well, so you can get some information that way as well. But you can always go to medical records for release of information and like official paperwork for that.
And I know that this comes up from time to time, and I know you all have information about this on your website. Some of our students who will be starting classes this fall but have not yet turned 18. Can you speak a little bit to having a minor here?
Yes. So we still, when you could check in, of course, we're going to confirm your birthday and it will notify us if they're under 18. A lot of times, if your student is under 18, actually, not a lot of times, every time, um, we will call. We need a consent to treat for a minor, at least the very first time they're seen, and we have that paperwork on file. So we can get it verbally and we'll have someone witness it and it's fine, but we will have to get a consent to treat. That's a good question. So if that's the situation and your student is 17, and they know they're coming in, perhaps coordinate with them just so that way we can get you quick and get your student in and out. Or if maybe that's not the case, just notify your student. If you're going to walk in and walk over there and see what's available, maybe go and make me aware when you go over there, just so that way we can get that kind of quickly.
That's good information. All right, Kristen's asking, where do we find the information to purchase the health insurance the university offers? I'm not sure if Kate's put that in the chat. I know it was on the slide, but we'll get that put in there as well. But any other tips about purchasing that SHIP health insurance you mentioned earlier?
So there is a specific like contact person for that. Her name is Chevy Mock, and she is very nice. In our typical full slide deck, we have her information on there. So will they have that as well from orientation?
Yep, they can go back and view that in that UK Guides app that they used at orientation. Those presentations should still be live in there.
So her contact information is there, and you can contact her. And it might be one of those situations where you just tell her, we have this kind of insurance, this kind of coverage. Does it make sense for us to get this? Or do you think this and supplement with the student health fee? And she'll kind of advise you as far as that goes.
Oh, that's helpful too. And Kate's put Chevet's contact information in the chat. Casey's asking about sending in HIPAA forms to share information with us about our students.
I would do
So
that
kind of
through
similar.
medical records.
So through medical records, and that's something they can access through My Chart, or is it information on the website?
The proxy is through My Chart, just so they can kind of see what's available in My Chart. But as far as like full access, you can do that through medical records.
All right, sounds good. All right, no more open questions right now, but we'll give folks another moment or two for any final questions that come up as we near 1 o'clock. As we're giving folks a chance to do that, I always like to give our presenters a chance to share any final tips, any words of wisdom, any frequently asked questions that you got at orientation this summer that we haven't touched on yet. So Dan, I'll start with you.
Oh, thanks, Nancy. So I just think that UK can be such a special place for students and for families, and I do hope you take advantage of all of our resources. I really do hope that you encourage your student to create what is a meaningful plan for them at this stage of their life in terms of managing their well-being. And we have the resources to make that happen for your student. So please do encourage them to seek out our services, including our blueprint, which is an opportunity for students to take our 8 dimensions and create a plan for their well-being. And that's housed in our power unit as well. So that's my final bit of advice there. I just really want students to see this as an opportunity to create those skills and strategies to manage their well-being now and for a lifetime.
Any final thoughts from the UHS perspective?
I agree totally. I feel like this is like a very unique time where we're kind of transitioning from living with parents and family kind of to a more independent lifestyle. And, here at UHS, we love to try to facilitate an independence in health, especially as we, start to take control of our own healthcare decision making and then doing that collaboratively with the family. And then after a while, letting the student kind of be a little bit more independent in that. Of course, we want everybody to be involved, but it is nice to see them kind of grow and come into their own. And I look forward to seeing them go from freshmen to seniors, and how much they mature in that time is crazy.
All right. No other open questions have come in, and so I think we've left folks with a lot of good information and things to consider as they support their student in this transition. Dan, Shelley, Andy, thank you so much for your time and presenting all of this. Kate, as always, thanks for putting all of the good information in the chat. Folks, we hope that you learned a lot today, and we hope that we'll see you soon at a future Cat Chat Live. But until then, have a great rest of your day and take care. Bye, everyone.